Thank you. We now have Dr. Abdul Momin Rizwan Ahmed.
Assalamualaikum. Can you listen to me?
We can hear you.
Okay, thank you. I'll be sharing my own slides. Okay. Right. Okay. Bismillahirrahmanirrahim. My name is Dr. Abdul Momin, and I'm currently working as assistant professor at National University of Medical Sciences. By profession, I am a clinical dietitian. So I'll be presenting on behalf of my students. So this small research project was titled as Health-Seeking Behavior of COVID-19 Patients in Islamabad and Rawalpindi. So we'll be starting off with a very brief introduction. Then we will be continuing with the statistical data on COVID. Then we will move forward to methodology, results, and then conclusions. So as everyone knows by now, I believe, COVID or a coronavirus, basically, it's an infectious disease which is caused by this particular strain of virus, which belongs to the family of SARS. This is basically a mild to moderate respiratory illness, and there are certain subgroups of populations which are more at risk of developing coronavirus disease. They mainly include older people or those people who have certain comorbidities, for example, diabetes mellitus, hypertension, or cardiovascular diseases. However, what we do need to remember is that anyone and anybody at any time can get sick due to coronavirus disease. It depends on a lot many other factors as well. And while some patients can recover on their own, some people require immediate medical attention. The symptoms of COVID include, there are some common symptoms which include fever, cough, fatigue, and loss of taste or smell, while the less common ones include sore throat, headache, aches and pains in the body, diarrhea, rash, and some people also have red eyes. So prevention, we have been seeing this over and over again for the last now almost 2 years.
Sorry to interrupt, but your slides aren't moving forward. It's still stuck on the first one.
Okay. I think now you can see.
Yes, we can.
Okay.
Yes, we can see it now.
Okay. Right. Okay. Okay. So just a second. I think these are not maximized somehow. Okay. Right. Just a second. Okay, so I was talking about prevention. So as far as the prevention of COVID is concerned, so obviously everyone knows we have to cover our mouth and nose while coughing or sneezing. Vaccination is the first and foremost thing. Washing hands frequently is also very important. Social distancing, even though you are vaccinated, that is still very important in terms of COVID prevention. So now coming quickly to the global figures. So I made this presentation 2 days ago on 22nd November. So according to that recent data, so as of now, there have been more than 25 crore confirmed cases of COVID-19 worldwide, and there have been 51 lakhs confirmed deaths. Similarly, moving to the EMRO region in which Pakistan lies according to the WHO's classification, so there have been 16, 6, 17, 210 confirmed cases of COVID in this region. Then moving forward to the national data, so in Pakistan the situation is has fortunately been better compared to rest of the countries in the EMRO region. So as of November 22, we have had approximately 12 lakhs confirmed cases of COVID-19. In the last 24 hours, there were 322 confirmed cases. Then similarly, deaths, 28,663 deaths have been confirmed, and the trend is now negative. So in the last 24 hours, we had only 3 deaths, fortunately. So coming to the objective of this current research, so we basically tried to determine the health-seeking behavior of COVID-19 patients in the twin cities of Islamabad and Rawalpindi. So for this particular purpose, what we did was we basically designed this small research. It was a cross-sectional study, and we took a sample of 300. Data was collected physically from the patients as well as using Google Forms, because it was not very convenient to go to COVID patients. Neither convenient, not recommended really to go to the COVID patients physically. So there we used Google Forms as well. Inclusion criteria was the residents of Islamabad and Rawalpindi, falling within the age bracket of 20 to 60 years, and those residents who were not from Islamabad or Rawalpindi originally, they were excluded from the study, or whose ages were less than 20 years or more than 60 years, because those would have changed the results drastically. So we excluded those study participants. Then for the determination of health-seeking behavior, we developed a structured questionnaire which included socio-demographic data as well as the previous medical history of the patients. The health-seeking behavior of patients during COVID-19, which was the main part of our research, that was determined using by asking them questions related to type of treatment, type of hospital, and home remedies which people used during the COVID-19 pandemic, and lastly whether they only used prescription or they also used non-prescription drugs as well. So as you know, self-medication is very common in Pakistan. So data was analyzed using SPSS statistical software. Descriptive statistics was used to determine the frequencies and percentages. All the ethical considerations were followed. So we took consent from the study participants, confidentiality of the data was ensured, and we also got ethical approval of the study from the Research Ethics Committee of the University of Lahore, Islamabad campus, where the student was based basically. So as far as the results of the study were concerned, you can see some socio-demographic data here. So we had approximately 59.3% males included in the study and 40.7% females. Then you can see the age group distribution as well. 48.3% study participants were single, 48% were married, 3.7% were divorced or widowed. Then coming to the occupation, 33.3% were doing some private jobs, government jobs 24.3%, 42.3% were not doing any work. So similarly, you can see the data for family income, household and family type. So now the most important part of the results basically, which was the health seeking behavior and the disease history. So 7.7% patients had diabetes, 6.3% patients had hypertension, while 10% patients had cardiovascular disease. The remaining 76% patients had none of these comorbidities. As far as the hospitalization was concerned, 27.3% patients were hospitalized, while 72.7% patients stayed at their homes. 90% patients were doing self-isolation, while 10% were not following any particular self-isolation. Out of the total study participants, 51% had one or more family members who were suffering from COVID-19 as well, while 49% had none of the family members suffering from the pandemic. Now this is the most important slide of the results, which shows the health seeking behavior of COVID-19 patients. So 10% of the study participants, they went to the local clinics for the treatment. 30.3% went to the private hospitals, while 50.3% patients went to the government hospitals in order to get themselves treated for the coronavirus. While there were 9.3% respondents who did not go to any place, they just stayed at home and they did either some home remedies or just as they say, they just had trust in the God that they will get recovered on their own. Mode of treatment, this was very interesting. So 25% people primarily relied on their diet. So they took a high protein diet, they took more foods in their diet, and they took more calories in their diet. So they did not use any sort of medications according to our results, our study results. 37.7% patients, they took pharmacological therapy, that is, they started taking medicines as soon as they were diagnosed with coronavirus. 10.3% patients used homeopathic medications, while 5.7% patients used some home remedies to treat themselves. And a big percentage of patients, 21.3%, did not do any of these. Again, as I said, they just had that firm belief that they will be recovered on their own. And lastly, 56.3% respondents also took some sort of spiritual support from some faith healers, while 43.7% did not seek any such support. So this was quite interesting for us, because as we generally perceive that people living in Islamabad and Rawalpindi, they would not really seek some spiritual support or stuff like that. So this was a huge percentage of patients which did that. So in conclusion, we actually witnessed highly variable health-seeking behavior among COVID-19 patients from Islamabad and Rawalpindi. Home remedies or self-medication was still practiced by a lot of people, and as I have just mentioned, more than half of the patients also opted for some spiritual support, which was not really what we thought initially. Lastly, preference for government hospitals was more compared to the private hospitals. That was probably due to affordability issues. So in the end, you can see some references. Thank you so much.
Thank you. Thank you, Dr. Abdul Momin.